Hi, my name is Dr. George Forgan-Smith, and I'd like to thank you for taking the time to consider getting a rapid HIV test. Today, I'd like to cover some important information it's important you understand before you get the test done. The rapid HIV test is looking for information from the body that occurs after infection with HIV. This test is not able to determine infection with any other sexually transmitted diseases. What the test looks for is the body's reaction to HIV infection, and these include HIV antibodies as well as a special protein produced by the body early in infection. For this reason, there is the concept called the window period. It takes the body a little while to produce proteins after HIV infection. For this reason, it can take up to 3 months before we are able to determine a potential HIV infection. We do know that using this test, we can detect HIV infection as early as 12 days after exposure. However, if your exposure has been within 3 months, it's important to get a second test later down the track to be 100% sure that there has been no infection with HIV. When we do the test, if your potential exposure to HIV has been more than 3 months, we know that a negative test confirms that you are not infected with HIV. If the exposure to HIV has been within a period less than 3 months, a negative test is a good idea that most likely you have not been infected with HIV. However, a second test a little bit later will need to be done to be 100% sure that there is no infection with HIV. If the test comes back positive, it's an indication that you may have been infected with the HIV virus. Occasionally, the Alere test can produce what is known as a false positive. This is when the result comes back positive even when a person has not been infected with the HIV virus. For this reason, if a test comes back positive, additional testing is required. Blood will be taken from your vein and sent to a laboratory where confirmation can be made whether or not you have been infected with the HIV virus. Occasionally, a test result could come back where we are not able to determine whether or not the result is positive or negative. In these cases, blood will be taken and sent to a laboratory where a confirmation can be done. So, what's going to happen during the test? First, we'll have a chat and make sure you fully understand what you are about to get tested for. This video is part of that process. When you're happy to go ahead, your finger will be cleaned with an alcohol swab. The finger will be pricked and a small drop of blood will be taken and applied to the test strip. This takes 20 minutes for the test to develop and it's able to be read after that. During this time, you may be asked to sit outside or we could organise additional testing as well. After 20 minutes, you'll be invited back in and we will read the test results together. Other things to consider when getting a HIV test is that other diseases are possible as well. For this reason, I do recommend considering other sexual health screens. These include urine tests for chlamydia and gonorrhea, blood tests for syphilis and hepatitis, and occasionally, as mentioned before, we may need to do additional blood tests to confirm whether or not a person has been exposed to HIV. I'd like to thank you very much for taking the time to listen to this video, and I hope it helps you understand a little bit more about using the rapid HIV test. If you have any questions, please ask your doctor immediately and we'll be able to go through those together.